Functional dyspepsia largely relies on fulfilling those Rome 4 feet diagnostic criteria we mentioned earlier.
Right, the checklist.
Kind of. It means a patient must experience at least one of these bothersome symptoms: postprandial fullness, early satiation, or epigastric pain or burning. That's step one.
Okay.
Then, crucially, there must be no evidence of structural disease, and that includes looking inside with an endoscopy that adequately explains these symptoms.
So the tests are normal.
Essentially, yes. And finally, these symptoms must have been present for at least 3 months, with their onset occurring at least 6 months before the diagnosis is made. This confirms they're chronic, not just a temporary upset stomach.
Okay, so it's truly a diagnosis of exclusion then. The path involves ruling out a whole range of other possibilities first.
Precisely. You have to be sure nothing else is going on.
So what kind of tests are usually part of that rigorous workup to exclude those other things?
Well, the diagnostic workup typically starts with a very detailed patient history and a physical examination, specifically looking for any of those alarm features we just discussed.
Makes sense.
An upper GI endoscopy is often a crucial step.
Yeah.
It lets the doctor look directly inside the esophagus, stomach, and duodenum to exclude things like peptic ulcers, significant gastritis, GERD complications, or even malignancy.
The camera test.
Exactly. H. pylori testing is also standard. This can be done via a urea breath test, a stool antigen test, or often through biopsies taken during the endoscopy itself.
Okay, what else?
If a specific issue like gastroparesis that severely delayed stomach emptying is suspected based on symptoms, then specialized gastric emptying studies might be ordered. These measure how quickly food leaves the stomach.
Right.
Standard blood tests are usually done too, like a complete blood count, CBC, thyroid-stimulating hormone, TSH, to check thyroid function, liver function tests, and maybe amylase lipase to check the pancreas. These help rule out other systemic or metabolic issues.
Okay.
And finally, depending on the symptoms and findings, an abdominal ultrasound or maybe even a CT scan might be used if there's any suspicion of gallbladder or pancreatic problems.
Wow, that's quite